the WHO advises that non-specialists should be trained to manage common mental disorders in the community. But Pakistan, like many other developing countries, is in a position where we have certain limitations. The healthcare and the mental health care has certain limitations. And it's important for us to understand those limitations because only then we'll be able to understand the composition of this group. The first limitation that we have is that the medical model that we practice both in general health care and in mental health care is primarily biomedical in approach. The MHCAP guidelines lay a lot of emphasis on psychosocial interventions. And for that reason, many of the either the graduating psychiatrists or psychiatrists who have just completed their postgraduate training and have now started to work independently, it's important to for us to ensure that they have the skills for psychosocial interventions as well. Some of the clinical psychologists that we have in the group have been working for a few years now. So there is very strong work experience also. But one of the limitations that we see with the practice of clinical psychologists is that sometimes it's difficult for them to either identify mental disorders or manage mental disorders. And there is this unwritten rule somewhere that people who present with psychosocial problems will go to clinical psychologists and people with mental disorders will go to psychiatrists. And I think these divisions are arbitrary because people we help, they don't carry these categories and they don't know whether they need a drug treatment or they would need some kind of psychosocial intervention. So I've been a psychiatrist for long enough and I know very clearly that most people that I have tried to help needed both. So in that way, I think it's time that we start encouraging clinical psychologists to manage common mental disorders and we start encouraging psychiatrists to lay more emphasis on psychosocial interventions. But the major category of non-specialists for which MHCAP guidelines have been prepared and are being implemented across the world are the primary care physicians. But I am really very grateful to Dr. Zaimzia, who has helped us by facilitating the presence of the 7 primary care physicians that we have in the group. WHO advises that 70% of common mental disorders can be treated in the primary care. So I would like tier 3 to think of themselves as mental health doctors or mental health consultants in the primary care. And most of the mental illnesses that are going to present you will be able to advise them. In the beginning, it's quite possible that if there's a psychotic patient, then the clinical psychologist might not be very comfortable and they might ask their colleagues who have better training in psychiatry to see that patient. But by the time we finish off this pilot in 6 weeks or 8 weeks, I expect that common mental disorders should be seen confidently by everybody on tier 3. The primary care physicians, they bring a wealth of experience with them. And we want to build on that experience. So it's not as if they do not know anything at all about mental disorders, but we would like to help them, gain more information and particularly some skills so that they also feel confident. And the purpose of this pilot is that, everybody will be supervised. So any one of you who is dealing with a person on the helpline and you're not sure how you want to manage or where you want to refer this patient, can immediately ask for advice. And once you register on our web portal, then all of you will have your own accounts and then you'll be able to log into your account and download your PDF, hopefully within the next 24 hours. Once you have your PDF, then between now and the 17th, I would like you to become very familiar with it. The more you read it, the more you refer to it, the more you look into it. You don't have to rote learn it. You don't have to rote learn anything in life, really. but becoming familiar with it is extremely important. If you do this hard work before the training, then during the 5-day training, you'll be able to participate more actively, and we can focus on your skills rather than just repeat what is already in the guide. So hopefully we'll work on the principles of adult learning. You will self-study and come prepared with the knowledge that is there, and you will use that training to clarify if there are any confusions or if there are some conceptual difficulties.